it is one of the largest cranial nerves. It is mostly sensory. So, as we know, it has three sensory nuclei. It has mesencephalic nucleus, it has pontine nucleus, and it has the spinal nucleus in the brainstem, and it has only one little motor nucleus, which is located at the bones in the upper part. So here we have all these nuclei mentioned. So blue ones are sensory, mesencephalic, pontine, and spinal nucleus. And here it is the motor nucleus, and it originates as two roots from the point where the middle cerebral peduncle connects with the bones. It originates there, and then it comes anteriorly to form the sensory ganglion on the anterior surface of the pyramid of the temporal bone. So if you remember, on temporal bone there is an impression, trigeminal impression, where the trigeminal ganglion lies. And after that, trigeminal ganglion, it separates into three main branches. So that's why it is called trigeminal, because it has three branches. First one is ophthalmic nerve, second one is maxillary nerve, and third one is the mandibular nerve. So ophthalmic nerve, the first branch of the trigeminal nerve, it will go to the orbit. It will pass through the superior. So first it passes in the lateral wall of the cavernous sinus under the cranial nerve number 4, and then it passes through the superior orbital fissure into the orbit. And in the orbit it separates into three branches, 1, 2, 3. First branch, which passes on the superior wall of the orbit, is called the frontal nerve. Frontal nerve, it passes on the superior wall of the orbit and then separates into the supraorbital nerve and supratrochlear nerve. Supratrochlear nerve comes more medially, near the nose, near the root of the nose, and supraorbital passes through the supraorbital foramen or notch. It's individual, and we can even palpate it here on the supraorbital margin, and it will innervate the skin of the frontal region. Yeah. So it's important to know this point as a terminal branch of the ophthalmic nerve for diagnostics of the different disorders of the trigeminal nerve. Because each of these three branches, it has one point where we can palpate it. So in ophthalmic nerve, it will be supraorbital nerve passing through the supraorbital nerve. The second branch of the ophthalmic nerve, it is a lacrimal nerve. Lacrimal nerve, it passes on the lateral wall of the orbit and comes to the lacrimal gland. So it takes part in innervation of the lacrimal gland and skin near the lateral angle of eye. On its way, so it is sensory nerve, but on its way it will take postganglionic, parasympathetic, and sympathetic fibers from the zygomatic nerve. So it has communicating branches from zygomatic nerve to the lacrimal, and it will bring these autonomic fibers to innervate the lacrimal gland. And the last branch of ophthalmic nerve is called nasociliary nerve. Nasociliary nerve passes more medially, so we can see it here closer, so the nasociliary nerve. And it will have totally 1, 2, 3, 4, 5 main branches. So first branch, it is a ganglionic branch. It will be the sensory root of the ciliary ganglion. So it will bring the sensory fibers to the ciliary ganglion to innervate then the eye. Also, it has the long ciliary nerve, long ciliary nerves. There are usually a couple of them, 2 or 3. They also perforate the sclera as the short ciliary nerves to pass into the eye and to provide the sensory innervation of the layers of eye, like sclera, conjunctiva, choroid. Then it has nasociliary nerve. It has anterior and posterior ethmoid nerves. Anterior and posterior ethmoid nerves, they pass into the anterior and posterior ethmoid foramina to enter the ethmoid labyrinth and innervate the mucosa of the ethmoid labyrinth. And further, anterior ethmoid nerve, it will give external and internal nasal branches, which will innervate the nasal mucosa and part of the dorsum, or the wing of the nose. Wing of the nose, yeah, partially. The superior part of the nose. And I forgot to tell you that each of the branches of the trigeminal nerve, it usually has a meningeal branch. So the meningeal branch of the ophthalmic nerve, it separates from the ophthalmic nerve inside the skull before entering the orbit. It can be also called tentorial branch because it takes part in the innervation of the tentorium cerebellum. Any questions about ophthalmic nerve? Then, maxillary nerve. Maxillary nerve, first it gives also meningeal branch to innervate the meninges in the middle cranial fossa. And then it passes through the lateral wall of the cavernous sinus to the foramen rotundum. And through the foramen rotundum, it passes to come into the pterygopalatine fossa. What happens in the pterygopalatine fossa? In the pterygopalatine fossa, maxillary nerve gives several branches. First, it has ganglionic branches which connect the maxillary nerve to the pterygopalatine ganglion. Pterygopalatine ganglion is a parasympathetic nervous ganglion which is located in the pterygopalatine fossa. It will take sympathetic and parasympathetic fibers from some other nerves. Sympathetic there will be postganglionic, parasympathetic preganglionic, and they will switch to the postganglionic. And by these ganglionic branches of the maxillary nerve, the exchange provided. So the maxillary nerve gives sensory fibers to the ganglion, and the ganglion gives the parasympathetic and sympathetic fibers to the maxillary nerve. What happens with these postganglionic autonomic fibers after they connect to the maxillary nerve? They then go with the zygomatic branch of the maxillary nerve, and from zygomatic branch they separate as a communicating branch to the lacrimal nerve. So they go to the lacrimal nerve and you take part in the innervation of lacrimal gland. And what happens with the sensory fibers which are connected to the ganglion? From ganglion there are several types of branches, like posterior nasal branches which go to the nasal cavity, take part in the innervation of the nasal cavity, nasopharyngeal branches, descending pharyngeal nerves, and descending palatine nerves, nasopharyngeal nerves. So these nerves, they will innervate the mucosa of the palate, hard and soft palate, mucosa of the nasal cavity, posterior part, and mucosa of the nasopharynx. Then maxillary nerve, I told you that it gives zygomatic nerve. Zygomatic nerve goes to the infratemporal fossa, and there it divides into two main branches: zygomaticofacial nerve and zygomatic-temporal nerve. Zygomatic-temporal nerve goes to the skin of the temporal region above the zygomatic bone and innervates the skin here. Zygomatic-facial moves more medially to the zygomatic bone and innervates this skin of the lateral facial region. Then maxillary nerve gives posterior superior alveolar nerves. Posterior superior alveolar nerves, they go through the alveolar foramina with the so-called arteries, which we have mentioned when we discussed the external carotid artery. They pass into the maxilla to form the superior alveolar plexus or superior dental plexus to innervate the teeth and gingiva of the upper jaw. And the continuation of the maxillary nerve, it is called infraorbital nerve. Infraorbital nerve, it will pass through the inferior orbital fissure into the orbit. In the orbit, it will go to the infraorbital sulcus, infraorbital canal, and go out of this canal through the infraorbital foramen. And you can even palpate it also, here under the zygomatic bones, you can palpate your infraorbital nerves. On its way infraorbital nerve, it will give anterior and medial superior alveolar nerves, which form this superior dental plexus with the posterior superior alveolar nerves. And here on the face, it will divide into several less branches, yes, infraorbital nerve, to the upper lip, to the vein of the nose, and to the lower eyelid. Questions? And the last branch of the trigeminal nerve is called mandibular nerve. So mandibular nerve, it is the only branch of the trigeminal nerve which has motor fibers. So all motor fibers of this nerve, they pass with the mandibular nerve to the external base of skull. So mandibular nerve, it goes directly to the foramen ovale and go out of the skull. What happens there? First branch, which is separated from the mandibular nerve, it is the meningeal branch. Meningeal branch of the mandibular nerve, it separates right under the foramen ovale, and then it returns back into the skull through the foramen spinosum. And then we can see that mandibular nerve, it has two trunks, like a lesser anterior trunk and bigger posterior trunk. Anterior trunk has mostly motor branches and one sensory branch. The only sensory branch of the anterior trunk, it is the buccal nerve, which will innervate the cheek. And several motor fibers, motor nerves. There will be deep temporal nerves, which innervate the temporalis muscle. It will have masseteric nerve to the masseter muscle. It will have the nerve to lateral pterygoid muscle. To the lateral pterygoid. And posterior trunk, it will have less motor fibers, like it will give medial pterygoid nerve to the medial pterygoid muscle, and some short motor fibers to the tensor tympani and tensor vellipalatine muscles. And most of it will form three large sensory branches. These sensory branches are lingual nerve, inferior alveolar nerve, and auriculotemporal nerve. Lingual nerve, as we can understand from its name, it will go to the tongue and innervate the tongue. So it will innervate, provide the common sensitivity, the touch, the pain, the temperature from the anterior 2/3 of the tongue, anterior portion of the tongue. On its way, it will take taste and secretory fibers from the cranial nerve number 7. So there is a branch of cranial nerve number 7 which is called chorda tympani. It is connected to the lingual nerve, and it will provide the taste, innervation from the anterior 2/3 of tongue, and innervation of the sublingual and submandibular glands. Next branch is inferior alveolar nerve. Inferior alveolar nerve, it will descend to the mandible and go to the mandibular canal. But before entering the mandibular canal, it will give the thin mylohyoid nerve, which will innervate mylohyoid muscle and anterior belly of digastric. This one. And the inferior alveolar nerve itself, it forms inferior dental plexus in the mandible to innervate the teeth and gingiva of the mandible. And it will terminate on the skin of the chin as a mental nerve. So it will pass through the mental foramen and innervate the skin of the chin and lower lip. You can even palpate it here, yes, where it goes out of the mandible. And the last branch of the mandibular nerve and trigeminal nerve, totally, yes, it is auriculotemporal nerve. Auriculotemporal nerve, it will go in the posterior direction. Here we can see how it curves around the head of the mandible. On its way, it gives glandular branches to the parotid gland. It gives articular branches to the temporomandibular joint. It gives anterior auricular nerves to the auricle, to the pinna, yeah, here. and it will terminate in the skin of the temporal region as a superficial temporal nerves. Any questions about trigeminal nerve? Okay, now we can go upstairs to the museum. I want to show you the trigeminal nerve. So here we have the trigeminal ganglion. Yeah, here it is. Do you see?
Let's see.
This. Yeah, here we have the trigeminal ganglion, and a small motor root is slightly visible here, coming to the mandibular nerve. And here we can see how it divides into three main branches. Yeah, ophthalmic nerve, maxillary nerve, mandibular nerve. So ophthalmic nerve goes to the superior orbital fissure. We can't see it here. We can see only its terminal branch here, supraorbital. Well, where it terminates. Then, maxillary nerve, what we can see here posterior superior alveolar nerves will be here, some branches of the zygomatic nerve, and infraorbital nerve continues into the orbit. Then we can see it here in the maxillary sinus and terminating here in the canine fossa, here infraorbital nerve, where we can palpate it. So here is one point, yeah, or it is for over the first branch, here the point of the second branch. And the mandibular nerve, it is better visible than other ones, so we can even see its main sensory branches, like the buccal nerve, yeah, lingual nerve goes to the tongue, inferior alveolar nerve and its mylohyoid branch, and the last one is auriculotemporal, here number 23. And here on this one, on this exemplar, we can see also all 3 points of the terminal branches of the trigeminal nerve. Here supraorbital nerve, here the infraorbital nerve, and here the mental nerve. Questions? And also I like this model because here we can see the regions of the skin divided into parts of different branches. So all this region is innervated by the ophthalmic nerve, this region is innervated by the maxillary nerve, this one is by the mandibular. And some major branches of this nerves we can see here. So there will be trigeminal ganglion, ophthalmic nerve with the lacrimal branch, frontal and nasociliary. Here we can see the ciliary ganglion also. This one will be maxillary nerve with the infraorbital branch, and here will be zygomatic branch. And the mandibular nerve with the buccal branch, this one, no, this one is auriculotemporal, buccal, lingual, and inferior alveolar. Okay.